Hello everyone. As we are all aware, there are as many as 67 cases of hospitalization due to the Guillain-Barré syndrome in the city of Pune, of which as of today 13 are reported to be on the ventilator. Campylobacter jejuni and norovirus infections are supposed to be one of the causative agents of the Guillain-Barré syndrome. In today's episode of Microtalks, let us try to understand this association. First, let us study what is exactly meant by the Guillain-Barré syndrome. This is a rare autoimmune neurological disorder where the body's immune system mistakenly attacks the peripheral nervous system. It is characterized by muscle weakness, which may lead to respiratory distress. This disease can also lead to sensory changes and paralysis. Sensory changes refer to the alterations or modifications in the way an individual perceives sensory stimuli. The exact cause is not clearly understood, but GBS often follows a respiratory or a GI tract infection. Its association with certain vaccines has also been reported. What exactly are the symptoms of GBS? The disease is characterized by tingling sensations that start in the leg and spread to the upper arm and upper body and the arms. There is difficulty in walking or climbing stairs due to muscle weakness. The elderly and the young children particularly may show severe symptoms. Diagnosis is often based on clinical evaluation of the symptoms and electromyography. The treatment includes supportive therapy and plasmapheresis. The prognosis varies from case to case. The recovery is either complete or partial with some sequelae. Let us now see what is Campylobacter jejuni. This is a gram-negative bacterium, comma-shaped, non-sporing, motile. It is microaerophilic and oxidase positive. This particular bacteria gained importance in 1970s as a cause of the GI tract infections. There are many species of bacteria reported, of which Campylobacterium jejuni is medically the most important. It causes zoonotic infections. It is the source of it being food of animal origin, especially raw milk. It is a part of the normal flora of the intestine of domestic animals and birds and is often shed in their feces. What is the pathogenesis of this infection and what are the symptoms of the gastrointestinal tract infection caused by Campylobacterium jejuni? This particular organism, as the name suggests, colonizes the jejunum and the ileum, and it can spread to the colon and the rectum. It can cause bacteremia. Bacteremia is a condition where the bacteria are also found in the blood. It invades the cells of the small intestines and it disrupts the fluid absorption. The stools contain leukocytes and blood. The infection normally is self-limited, though the bacteria can be shed for weeks after the recovery. Now, what exactly is the mechanism of association between the Guillain-Barré syndrome and the infection caused by Campylobacterium jejuni? So, the first mechanism is molecular mimicry between the bacterial lipooligosaccharides, which are found on the bacterial cell surface. They share a structural similarity with gangliosides, which are found in the nervous system, especially in the peripheral nerves. This similarity confuses the immune system, resulting in an autoimmune response. In an autoimmune response, the antibodies that are produced by the immune system against the bacteria also attack the peripheral nerves. The second mechanism obviously is the immune response showed by the human body against the infection caused by Campylobacterium jejuni. The body produces antibodies in response to infection. These antibodies can cross-react with the nerve components, leading to demyelination and nerve damage, which is characteristic of GBS. The third mechanism of association is the increased incidence of GBS post-infection because of the circulating immune complexes which have not been removed because they are incomplete. Individuals who have had Campylobacterium jejuni infection therefore have an increased risk of GBS due to the presence of these incomplete circulating immune complexes. Coming to the diagnosis, when a patient presents with symptoms of GBS, it is important to understand whether there was a recent history of gastroenteritis, particularly caused by Campylobacter jejuni. Understanding the link between the Campylobacter infections and GBS underlines the importance of food safety practices and prompt medical attention for gastroenteritis. In summary, we can say that Campylobacter jejuni plays a significant role in the development of the Guillain-Barré syndrome through mechanisms such as molecular mimicry and immune response activation. Awareness of this association is vital for early diagnosis and management of GBS following a Campylobacter infection. Thank you very much. I will see you again in the next episode of MicroTalks.